Well, let's now return to the biotech space, and regenerative medicine company Orthocell is focused on developing products for the repair of a variety of bone and soft tissue injuries. Orthocell's portfolio of products includes Striate, approved for dental applications in many countries, SmartGraft for tendon repair, and Remplia for peripheral nerve reconstruction, which was approved in the US, with the company appointing distributors, with sales expected to follow shortly. The global addressable market for Remplia is rapidly expanding, with Orthocell having just been granted a medical device licence by Health Canada to allow its sale. Here's Orthocell's Chief Executive and Managing Director, Paul Anderson.
Many thanks, Andrew, for the invitation. As Andrew mentioned, my name is Paul Anderson. I'm the co-founder, CEO and Managing Director of Orthocell. We're a regenerative medicine company which focuses on the regeneration of human bone, nerve and tendon tissue. And today's presentation is really designed about giving you some really key insights into the introduction of our flagship product Remplia into the United States following our recent US FDA clearance to market the product within the United States. This is really a defining moment for our company. The 510K clearance is a really important milestone, enables us to market our product within the United States and enables us to access now a market of excess of $1.6 billion in addressable market. So a really exciting commercial opportunity and one that puts us on a major revenue inflection point. It provides the catalyst for the company now to drive towards break-even and profitability within a foreseeable timeframe. And I'll work my way through that as we go through the presentation. What's really important to note as a company that we manufacture these products ourselves. We've scaled this manufacturing capability. We now have the capacity to produce over 100,000 units. We have a significant inventory in place, and all the material capital costs associated with ramping up the production have already been incurred. So it leaves us in a great position with a scaled up manufacturing facility. That's only one part of it though. You need to be able to supply these products into this very large and busy American market. You need to have the logistics sorted. We've been working really hard in the background to secure our logistics partner, and I'm going to talk about that, Uniphar, as we go through the process. It enables us to have a central coordination of warehousing, order processing, the shipping, and indeed even customer service and office space. So a really important part of the whole conundrum is outsourced logistics. We have a proven sales model. This is not the first time that we've worked in introducing a product into the United States. We understand that it takes key opinion leaders, it takes centers of excellence, and it takes internal sales, marketing, and medical education teams, combined with 12 US distributors covering 21 states. So we now have a proven sales model. We know how to achieve the success. We have the internal workforce in place. And we also now have recently just announced 12 distributors that are covering 21 states. And to complement all of this, we also have a really strong balance sheet with over $32 million of capital in the bank, enabling us to really undertake this US rollout. So we're really in a prime position. So Remplia is French for fill, and this is effectively what we're doing is that we're redefining how surgeons repair a nerve. And so there's over 700,000 peripheral nerve injuries in the US per year, either crush or severed injuries. This product acts to reduce the number of sutures that are required or negate the number of sutures that are required to join those two nerves together again to give them a chance to re-heal themselves. And so this product that we've developed, Remplia, is redefining nerve repair. It's a collagen nerve wrap, which is designed to wrap around the nerve, provides a compression-free protection of the nerve, and generates the ideal microenvironment that aids and improves the nerve healing. The product itself has exceptional handling characteristics. It's designed to mimic the outside edge of the nerve called the epineurium. It is the only product in the market today that does that. It reduces the need for multiple sutures and as a consequence reduces the scar tissue formation that happens around the sutures. And it returns the nerve to its pre-injury state. So Remplia, as it's known, is guiding predictable and consistent outcomes in peripheral nerve repair. What got us initially really excited about this technology was not just its handling qualities, not just the way that it performed, but was the clinical results that we saw as a result of the clinical study that we produced. And what the baseline here means is that it's paralysis. So anything under the line is a paralyzed limb. And so we were able to demonstrate in a defined clinical publication paper that's now been published that at 12 months we had a 76% recovery. And at month 24, some 2 years after the nerve repair, we had an 85% recovery, a voluntary movement of improved strength and range and motion. And so when we see that these patients we've been able to convert paralyzed limbs to functional limbs with voluntary movement and strength and range and movement. And so 85% is an outstanding result. And our surgeons are saying to us now that we're seeing consistent return of arm and hand function following nerve transfer surgery with Remplar. And it's increasing the success rate and the efficiency of the transfer surgery. So we're seeing increased efficiencies with the surgery. We're also seeing cost economic benefits to society and to the patients themselves. And so what do we use it for? We use the product to connect nerves together. We use the product to protect nerves where they've been compressed and scar tissue. And we also use it to cap nerves where we've got amputated nerves that are left effectively flapping in the breeze, and our product is used as a chef's cap to sit over the top and stop the neuromas, the painful neuromas and complications from that. This product was first introduced into the Australian marketplace. It is now registered here in Australia and reimbursed here in the country. And in the last 2 years of delivery of this product into the market, we now have over 200 plastic reconstructive surgeons and orthopedic surgeons who use our product in over 150 hospitals. So this has been an outstanding product launch in Australia. And what that's meant is that we've learned a lot about the characteristics of the product. We've learned a lot about how to apply the scientific narrative, and that leaves us in an ideal position as we move into the US marketplace. Because the current way of approaching, by and large, the majority of the way that nerves are joined together is using a needle and a thread. And I think it was back in the late 1800s that the first reported use of a needle and a thread to join nerves together. So we thought as a company, we know that we can do better than that. We know that we can improve on a technique that was first introduced in the late 1800s. And what happens, as you can see in these two pink pictures on the right, the two dots that you can see in both of those pictures are actually holes that have been formed in the nerve by the needle and the thread. And those holes and the needle and the thread cause significant scar tissue. And when you have significant scar tissue from a foreign body reaction, it leads to chronic inflammation, fibrosis, and scarring. And that in turn leads to a suboptimal axonal regeneration and return to function sensational. So these results are pretty poor, and they result in inconsistent and unpredictable clinical outcomes. As a result of those inconsistencies and those scar tissue buildup, we have seen a couple of other companies come into the marketplace and introduce nerve conduits. These nerve conduits, however, haven't really been fit for purpose. They're hard, they don't go around corners, they don't fit multiple nerves. You have to have a very large inventory. And fundamentally, though, the products themselves are not fit for purpose. They either disappear too quickly or they take too long to disappear and they get encapsulated, which is what you can see in the central picture here. The dark purple colour has been encapsulated by scar tissue, impeding the regeneration of the nerves, again leading to compression and neuronal formation. So the failure to fully integrate into the native tissue leads to residual material that impairs the healing process. And it's Remplar that you can see in the right-hand side here that incorporates into the nerve and replicates the epineurial tissue on the outside, forming a barrier, yet encouraging the tissue to heal inside. So this is the first product in the market today that's biocompatible, bioabsorbable at the right time point, commensurate with the nerve healing and mimicking the outside edge of the nerve. So these are breakthrough moments for our company and for this product. And so when we talk about the commercialization platform, well, how do we take this great science and this great innovation that was being developed here and translated here in this country into the United States marketplace and the international sphere? So we do that by having a really strong manufacturing base. We do that by having strong logistics, and we do that by having internal sales and medical education and marketing teams that work with our distributor network to provide us with product into the marketplace. We've developed this manufacturing process here in Australia. We've validated this manufacturing here. We've now supplied the product for over 2 years into the Australian marketplace. We've worked out any bugs that were there, and we now have over 100,000 unit capacity in our facility. And this is an actual picture of our facility on the right-hand side. We're already now approved in Australia, New Zealand, Singapore, Thailand, Canada, and most recently in Hong Kong. So we now have demonstrated that we have a significant global footprint for regulatory approvals of this product. We know what we're doing in this space, and we now have some of the very highest qualifications for our manufacturing facility, which is called MDSAP and MDR qualifications, which is leading the world in that scenario. We have significant inventory in place, and I think it's really important to note that when manufacturing a product here in Australia, we have a 3-year shelf life, which is longer than 2 years, which is most of our competitor products. So we understand that that's a really important part as a part of our manufacturing, and importantly, as regards to our logistics and shipping. So we've partnered with a group called Unifarm, which is a good manufacturing practice certified company. They enable us to ensure compliance with the FDA and ISO and DSCA regulations, and they can do same-day shipping. So we now have shipped our first 1,000 units to this facility. We're preparing for our second shipment in preparation for our sales and marketing initiatives and the rollout of this technology. We've been in a really, really fortunate position to attract 3 of the very best nerve guys in the business. Now, John Walker, Vice President of Sales, highly experienced in the sales process, and has spent 9 years working for one of our direct competitors in a sales role. So he's led the growth of nerve repair devices such as Axogen, which is one of our potential competitors. Philip Edmondson, Vice President of Medical Affairs, a really important role in the United States. Award-winning medical affairs professional who's excelled at the advocacy, implementing successful medical education programs that contribute to continual sales growth. And last but not least, we've appointed Kevin Leach as Head of Marketing. So we have sales, medical affairs, and marketing. And all 3 of these gentlemen have come from our major competitors. And so they've seen not only the potential of our product, but the potential of being involved in a company like ourselves within the United States. So we've been extremely fortunate to attract, those 3 real professionals in this space with fantastic domain knowledge. And so in conjunction with our own team and our US team, we've been working really hard for the last 6 months on preparing all the activities for the pre-launch that are required, completing our FDA approval. We've also just recently announced that we've now got 12 distributors appointed. We did say that we'd have 10 before the end of this financial year, so we're ahead of the game with 12 distributors appointed, and we're really working in conjunction with those guys and our own team to strengthening our panel of key opinion leaders, to making sure that we have those key opinion leaders well supported by centres of excellence or hospitals that are reference sites who are going to drive the early sales. And we have medical education programs that are cemented into the United States marketplace, making the marketing collateral ready to roll out following the FDA approval. And of course, driving towards the ultimate goal of reimbursement within the United States. But importantly, we've just recently completed our first pre-launch activities at one of the largest global nerve-focused conferences for both orthopaedic surgeons and plastic reconstructive surgeons. And what that conference really enabled us to do was to make sure that our scientific narrative was robust, and for surgeons to opine on our product, to handle the product, to practice using the product. And we've been really delighted and encouraged that our scientific narrative is making sense to the surgeons, and finally they can understand why they get inconsistent and unpredictable clinical results. And so the use of our product, we see, because it handles so well, it shortens the surgery times and increases patient outcome, is a highly desirable product for these surgeons. And so in conclusion, we are at a commercial stage. We have revenue inflection point following this US FDA approval for our flagship product, Remplir, with the pre-launch activities completed. We have key opinion leaders, centers of excellence lined up, ready to go. We now know that this is absolutely a best-in-class product. The 2 years of experience in Australia has been invaluable. To have reimbursement in this country, to have over 200 surgeons in over 166 hospitals use the product, has been a really strong driver in our confidence that we can now take those learnings and really capitalize on those into the American marketplace. We've got a really strong board, a really strengthened board, one that supports me and our staff to really drive this unique and fantastic product into the US marketplace. Importantly, we have $32 million cash at bank with a strengthened institutional share registry. And so we've got great share price momentum. We're well funded for the US rollout. And really importantly, we own our own manufacturing facility. We own the facility. We also own the production margins. And so we're able to improve on those margins and to make sure that we have control over our intellectual property. So we own that manufacturing, we own those margins, and we own that intellectual property. So what are the upcoming catalysts? US market clearance and pre-launch has been achieved. Our appointment of our first 12 US distributors focused mostly on the East Coast has been achieved. We recently this week just announced that our Hong Kong product registration has come, and that's on the back of an incredibly busy regulatory period for us. First of all, we had Australian approval for Remplir, then we had Singapore, that was followed by Canadian and Thailand approvals, and as I mentioned, Hong Kong. So an incredible achievement for a really busy regulatory team. We've appointed our first sales team members, which has been a fantastic outcome, and really looking forward to, by the end of Q2, our first sales in the US, with all of the lead-up work is now being done. And of course, future regulatory approvals in the EU and Brazil, which is a very large market as well. So really set on a really fantastic trajectory with Remplir. And as Andrew mentioned at the top, we also have a product called Striate Plus, which is for bone regeneration. We've partnered with a large multinational American company who paid us $23 million up front for an exclusive license to distribute that product. And in conjunction with them, we've recently launched in Germany, Austria, Switzerland market launch, a Singapore product registration, a Brazilian product registration, and a Hong Kong submission has been lodged. So you can see that we're a busy company and we've got a growing revenue inflection point as we now roll out into these European, US marketplaces that lay in front of us. Thank you very much for your time. Cheers.
Well, Paul, thanks so much for your presentation. Let's get to some viewer questions now. The first one asking with Remplir's FDA clearance and a $1.6 billion US market opportunity, what specific steps are you taking to capture market share there? And how many procedures do you aim to address in the first 12 to 18 months?
Yeah, no, they're great questions. And I mean, I think one of the fantastic advantages of having our product approved in the Australian marketplace and reimbursed in the marketplace is that we've been able to road test this product. And so we now know that we have an outstanding scientific narrative, which is second to none, and outstrips any of the potential opposition in this space. We also know that we've got surgeons now with the recruitment of 7 of the very best surgeons in the country, and they're supporting centres of excellence, that they're enamoured by this product. They're enamoured by the handling qualities. They're enamoured by the science, the clinical results, and the scientific narrative. So we're really confident that we can drive into this space with that knowledge base. But to do that, you need to have the infrastructure. And so we've also been able to attract some of the very best people in this business who have significant domain knowledge as to the driving forces within the nerve repair in the United States. So a great product, a great narrative, and a team in place that is going to be driving those revenues. And the second part of your question was about the revenue. And so to do that, you need to have all those building blocks in place. And so I guess, I can put it very simply in these terms. In Australia, in the second year of our operation, we'll be doing in excess of 2,000 units within that marketplace. Now, if we're to replicate that into the US, that's several $1 million of revenue to us just from a toe in the water perspective. So it's a really exciting juncture for us. We've got all the building blocks in place and really looking forward to driving those revenue generating activities.
Now, Paul, your presentation noted that current nerve repair devices are not widely adopted due to rigidity and poor integration. How does Rempler's clinical data and design give it a sustainable edge over competitors? And are there any emerging technologies that could potentially challenge your position in that space?
Yeah, so most of our competitors in the market have old technology. They've been around 15 to 18 years. And so, what was once a good idea is now proving to be less so. And so the rigidity of those products, the fact that they don't absorb very well into the body, the fact that they need really, really large inventories are all impediments to their uptake. And so the market is predominantly governed and driven by doctors using a needle and a thread. And so we've been able to show, not just us, but others have shown that, that's not such a good idea and causes a lot of scar tissue. And that scar tissue impedes a consistent and predictable outcome. And so our product is very flexible. It's a collagen cigarette paper, if you like, that acts like a bit of Velcro. It wraps around the nerve. It joins the nerves together by either negating or reducing the number of sutures. It provides what we call a bioactive chamber, so it's enhancing the healing characteristics of the nerve itself. And so not only are we providing a better science and a better clinical outcome, we're also reducing the amount of time it takes to do these operations. And so we're seeing great cost economic benefits at the coalface in surgery, but we're also seeing fantastic cost economic benefits to the patients who are making great recoveries from returning paralysed limbs to functioning limbs.
Paul, another question coming to us. You've appointed 12 distributors covering 21 US states. What's the timeline for expanding coverage to additional states? And how would you balance in-house sales efforts with distributor performance to maximise your revenue growth?
Yeah, so the team of direct sales that we have in place are really designed to educate those distributors, to motivate those distributors to do field calls with them, and to really jacket them in who we are as a company and what our ethos is, to really provide all the ammunition that they require from a marketing and collaterals perspective to drive the sales into the US. And so, that's a really exciting part for us. We're really excited about the whole of the United States. But what I think is important to note is that the greatest concentration of population is on the East Coast, and that's where we're starting our endeavours. And so we really want to bed that down. We said that we'd have 10 distributors by the end of the financial year. We've appointed 12. And we've been working on that for the last 6 months or so. We've appointed 12. They're of the highest quality. They've got intimate relationships with their surgeons and the hospitals, and put us in a fantastic position to drive then into the West Coast and other jurisdictions within the United States. So we think, within 6 months we'll have, all 52 states covered.
And Paul, just finally, a question on your financials. With $32 million in cash reserves and a scaled manufacturing facility, when do you expect Orthocell to reach break even, and what are the key cost drivers for the US rollout?
Yeah, look, I think, we're in a much better position than we've ever been in, with increasing revenues both here from Australia, but we'll be in the US as well. Obviously the infrastructure in the US doesn't come that cheaply, but we're positioned and funded to do so. So, we're really excited about the fact that we've got enough capital in the bank to really drive this technology forward. And we think that, over the next couple of years that we can really drive towards that break-even scenario.